We have no one on yet, so we're just kind of gonna wait.
Okay.
Good morning, everybody. My name is Katie Chuba. I'm with the Heartland Area Chamber of Commerce, and I welcome you to today's webinar. And I'm just gonna sit here and patiently wait. We have some attendees that are still signing on and joining us this morning, so we appreciate your patience and hanging out just for a couple minutes here. We have a fair amount of people that have signed up today. So we are going to do a fancy stall for a few minutes and wait for everyone to join us this morning for today's Medicare 101 webinar. So we thank you for listening in and viewing. We have a great, Beth has a great presentation planned for you today. So we're just going to hang on a few more minutes here, so we appreciate your patience. And Beth, we'll just wait just maybe about another half a minute or so, give the folks that have signed up a little chance to sign on, and then we'll begin, because we value your time, so thank you so much.
Well, thank you. I appreciate that. Everybody's time, this time of year, everybody's time is very valuable. So we all have things that we need to do.
Amen.
I appreciate all of you guys clearing your calendars and clearing your schedule just for this hour to allow me to come in and talk about this. So
well,
I
it's
appreciate
important.
that.
It's important, and it's good information folks need. So.
Well, and it's very confusing if you don't understand.
Mm-hmm. Well, we'll go ahead and get started. Thank you again, everybody, for joining us on today's webinar. My name is Katie Chuba from the Heartland Area Chamber of Commerce. Along with the Livingston County Catholic Charities, we've collaborated with the Livingston County Chamber Alliance, which are the 3 chambers in the county, the Heartland, Howell, and Greater Brighton. And so with this, we've brought to you, in partnership with Livingston County Catholic Charities, this webinar series. You can find it on any of the chamber's calendars, or you can certainly call us and we'll give you the information. But today I'm joined today by Beth Newman. Say hi, Beth, everybody. And Beth is the senior community liaison, or one of the senior community liaisons with Livingston County Catholic Charities, to talk about Medicare 101 2021 open enrollment and all that good stuff. So Beth, tell us a little bit about yourself, your background, what you do for Livingston County Catholic Charities, and then we'll begin. I know you have a great presentation plan, so I'm going to turn it over to you. Thank you again for joining us today.
Oh, well, thank you very much for inviting me and allowing me to come and talk. I appreciate that. Just a little about myself. I'm a senior community liaison at Livingston Catholic Charities. And what that is that's just a fancy title of being the person that connects seniors and their families to the resources that are within the community so that seniors can age in place. Whether that's the insurance like we're doing today, hooking them up with Meals on Wheels, getting them medical equipment, anything that the resources that are out within the community that we can access to allow them to be able to stay at home safely, comfortably, and with a peace of mind. The other piece that I do is obviously the Medicare Medicaid Assistance Program, or MAP, as we'll talk about here shortly. And then the other piece that I do, I'm the Elder Abuse Prevention Specialist that works with educating the community and families about what exactly elder abuse is and how we can prevent it, how we can recognize it, and how we can go to lengths to make sure that we have a community that has zero tolerance for elder abuse. So just in a nutshell, that's kind of what I do. This time of year, we're doing, it's called open enrollment, that we'll talk about, and people that are new to Medicare, people that are already in Medicare, but they need to sign up for a prescription plan, or they're just not happy with the plans that they have. This is the time of year that we can go ahead and we can get people educated on the insurances. So without any further ado, I'm going to go ahead and share my screen, and we'll get started on this. There we go. Like I said, and like Katie has said, this is Medicare 101. We are going to talk today about Medicare and Medicaid through the assistance program. And what exactly is the Medicare Medicaid assistance program? We are comprised of unbiased counselors, and what that means is we can counsel you, we can talk to you about the different plans, but we have no stake in whatever program you sign up for or whatever plan you sign up for. There's a lot of places out in the community that are called insurance brokers, and the difference between them and us is that they kind of get a little stipend, or they get paid from certain insurance companies to sell and promote that plan. We cannot do that. If we get caught doing that, we lose our certification and we're no longer able to counsel through the MAP program. We have locations across the entire across the entire state of Michigan. Doesn't matter if you're up in Copper Harbor or you're down in New Buffalo. It doesn't matter. We have locations across Michigan, and our services are completely free. We cannot collect any charge or any tips or anything from doing the counseling. So how can I, as a MAP counselor, help you? So what I can do is I can help you understand the new healthcare options. As all of you are aware, and as all of you have seen on TV, they kind of bombard us with these new, or what they consider new insurance plans. You know, the changes, you know, one of the ones is Aetna is now WellCare, still the same policy, just changed their name. I can help you understand the Medicare and Medicaid actual insurances. They all have little caveats about them that I swear the government makes them intentionally confusing for people. You know, so we can kind of work together to go through those. We can compare the different prescription drug coverages that are out there. You know, we can go ahead and we can put in a list of your medications. We can put in your zip code, your age, your sex, all of those, and we can look at the different prescription drug coverage to make sure that you have the best, most financially sound coverage. And we can look at your supplemental insurance needs. We'll talk about it here in just a minute, but as I'm sure all of you know or may not know, Medicare only covers 80% of an approved amount. So that kind of leaves a 20% hanging out there, where if you don't have a supplemental policy, you're going to be responsible for that 20%. Oops. Sorry about that. I can help you understand the different Medicare health plans. You know, the Part A, the Part B, the Part C, the Part D. When you're first hearing about it, it's just very confusing and it all kind of blends together. By the time you're done and you're hearing all of this, if you're new to Medicare and you're just turning 65, you know, a lot of times people have been covered under their employer's health insurance, and a lot of that stuff was taken care of, and you didn't have different parts that paid for different things. And probably right now, one of the biggest things that we can do as a MAP counselor is we can identify and report Medicare and Medicaid fraud and scams. I'm sure every single one of us that is on this webinar has received a phone call saying that you are entitled to a knee brace or a back brace. And all you have to do is just give them your Medicare number. Well, you give them your Medicare number and they send you this brace that is for someone that is half the size of you, that doesn't fit properly, and it's not even for what your problem is. And where that becomes a problem is now you have given whomever access to your Medicare numbers, so they can go ahead and they can bill your Medicare insurance for services that you never received. And when you are ready to get something like a brace, or you need to have a procedure done, Medicare is going to be like, sorry, you already had that done 6 months ago. So that's a problem. Right now with COVID, the biggest thing right now is people will call you and say that because you're on Medicare, you qualify for a COVID relief box. Well, what this COVID relief box is, and they tell you that, oh, you're going to get masks and you're going to get hand sanitizer and you're going to get gloves and you're going to get a vaccine to prevent you from getting COVID. As we all know, that doesn't exist. All you have to do is give them your Medicare number, and it's a free service. And you wait and wait and wait and wait. And if you ever do receive a box, the only thing that's in that box is one mask, one glove, and one trial size hand sanitizer. So you have now just given whoever this person is or whoever this company is your Medicare number, and they're billing for all these services. Another one that we've seen that's coming up with this COVID too is contact tracers. They will call you and say, somebody that you've been in contact with has tested positive for COVID. You need to give me your Medicare number so that we can have you go and get tested. Well, that's not how the contact tracing works. They're never going to ask you for your Medicare number. So those are things that right now, this time of year, and during this whole pandemic, people are kind of taking advantage of. So you need to be wary of that. So getting right into the meat of the presentation, what exactly is Medicare? We hear people talk about it all the time, and we just assume that, oh, well, they know what Medicare is. If you're not into this, it's very easy to get confused between Medicare and Medicaid. Medicare is specifically health insurance that target 3 different groups of people: people that are 65 and older, people that are under 65 that have certain disabilities and the state has deemed that they are disabled, and any age if you have end-stage renal disease. The other part of Medicare is the administrative part of it. The Center for Medicaid and Medicare and Medicaid Services are known as CMS. They are Medicare. And they also take care of the enrollment piece of it through Social Security Administration. That's how most of us enroll and get in and learn about Medicare. There's also, they handle the Railroad Retirement Board that is for the railroad retirees. So how do you enroll in Medicare? Well, most of us, it's automatic if we receive Social Security benefits or we receive Railroad Retirement Board benefits. The initial enrollment period package will be mailed to you 3 months before your 25th month of being on disability, or 3 months before you turn 65. Just to kind of clarify the 25th month of disability, if you're receiving Social Security disability, you have to be on that for 2 years before you can become eligible for Medicare. So 3 months before that 25th month, you'll receive your Medicare instructions and your ability to enroll in Medicare. Now, how do you enroll in Medicare? Well, enrollment to Medicare, like some people think, is not automatic. You're not, as soon as you turn 65, you're not going to just magically be enrolled in Medicare. Most of us don't receive Social Security benefits or railroad benefits. Most of us are still working until we're 65 or beyond. So what you need to do is you need to enroll with Medicare through your Social Security office. And you can do that through visiting. In normal times, you can't do it now, but when we're not in a pandemic, you go to the local Social Security office. You can call 1-800-772-1213, or you can go online at socialsecurity.gov. If you retired from the railroad, they kind of have their own little department within Social Security and Medicare. So you need to call the Railroad Benefits Office at 1-877-772-5772, or you call Catholic Charities, and we can go ahead and we can get you enrolled in Medicare, and we can get you enrolled in your Social Security, or we can walk you through the steps. A lot of people are afraid to get onto their website. A lot of our seniors or people are not as techno savvy or computer savvy. So they get kind of scared and they get leery, and plus, they're dealing with the Social Security office and they don't want to mess anything up because they're afraid if they do, they're not going to get their Social Security benefits. So, any of those three ways. Now, when do you enroll in Medicare? Well, people are working later in life right now. So you don't necessarily have to be retired when you enroll in Medicare. Your initial enrollment period lasts 7 months. So you've got 3 months before you turn 65, the month you turn 65, and then that initial enrollment period ends 3 months after you turn 65. There are other times that you can enroll, and we'll talk about those here in just a little bit, but there's like the special enrollment period, but you've got to be kind of careful with doing that because Medicare does charge a penalty if you don't enroll when you're supposed to. Now, we can look at your Medicare card on that glorious 3 months before you turn 65. You're going to get your Medicare card. And on your Medicare card, on the bottom right, it'll have the dates that you become eligible for your Medicare Part A and your Medicare Part B. So what do you do with this? So if you keep it and you don't send it back or don't do anything with it, then that tells Medicare that you are accepting Medicare Parts A and Medicare Part B. But if you're still working or your spouse is still working and you're covered under their employer insurance or employer benefits, you don't necessarily need to sign up for Part B. So you turn the card over and you can see where there's instructions on there for you to sign it, print your name, and then go ahead and send it back to the Medicare or Social Security office, and that's alerting them that you are not accepting your Part B right now. And we'll talk about that and more in just a little bit here. So what are the 4 parts of Medicare? Part A is what people typically call the free Medicare. That's your hospital insurance. That's the one where all of us have worked our entire life to get that hospital coverage. And then Part B is typically called the doctor's office insurance or the medical part of it. And then Medicare Part C is the Medicare Advantage plans. And we'll talk about those here in just a little bit too, but those are HMOs and PPOs. And the Part D, which is the Medicare Prescription Drug Coverage. And here, this is actually from the Medicare and You handbook, and it actually talks about the different steps, and if you go with the original Medicare, what original Medicare includes, the Part A and or the Part B. And then you can decide if you want to get a prescription coverage, which is the Part D. And then you can decide if you want to get supplemental coverage or Medigap policies. And there are handouts that has this on it as well that I think Katie included and sent the links to, so you guys can get this. And then if you decide to choose an Advantage plan, what do you do if you choose the Advantage plan, what step 1 is and what step 2 is? And we'll go through those a little more clearly here throughout the presentation. So original Medicare. Original Medicare has Part A, which is what I said is the hospital insurance. So what exactly does that cover? That covers your hospital visit or your hospital. That covers if you have to go to a skilled nursing facility, like a rehab facility or a nursing home. It covers home health care, and it includes hospice care. There is a deductible with your Part A that you would have to pay first. This year, we don't have the 2021 numbers yet, but the 2020 numbers, it was $1,408, I believe, or it could have been in 1,048. Anyway, it's 1,000, I think it's 408, that you would have to pay first before Medicare would start paying 80% of the approved amount. Okay, and then the Medicare Part B is the one that covers doctor's visits, outpatient hospital services, clinical lab tests, and preventative services. Okay, and here it talks about, it's 1,408. Woohoo! That talks about your Part A costs. Oh, sorry. If you're in the hospital, it will cover a semi-private room and board, general nursing and other hospital services, and supplies. For the first 60 days, you would be responsible for $1,408. Days 61 through 90, you would be responsible for $352 a day. Days 91 through 150, you would pay $704 a day. And anything beyond 150 days, you would be responsible for the whole cost. Now you go into, if you had to go into a rehabilitation center or you had to go into a nursing home, it will pay for a semi-private room and board, skilled nursing and rehab services, and the other services and supplies. For the first 20 days, you would have to pay nothing. Okay, then you can get an additional 80 days and you would have to pay up to $176 a day. And then anything beyond 100 days, you would be responsible for all costs. Now, for home health care, it covers part-time or intermittent skilled care, home health aid services, durable medical equipment and supplies, and any other services associated with that. You are allowed up to 100 visits following a 3-day hospital stay, as long as you meet Medicare conditions. So just real quickly, what that means is you could get up to 100 visits if you were in the hospital for at least 3 days, and after your discharge, the doctor wrote an order saying that you needed to have home health services in your home because you can't get out of bed, or because you can't stand on your feet, or you're very unsteady on your feet, you're a fall risk. There's a whole list of conditions that Medicare has that the prescribing professionals know that you would need to meet those first. And if you met all of those criteria, you wouldn't have to pay anything for services. Your medical equipment that would be associated with that, things like a hospital bed, or a shower chair, or a Hoyer lift, anything like that, you would have to pay 20% for. And then hospice, as long as your doctor certifies that there is a need, you would only have to pay a limited amount for outpatient drugs and inpatient respite care. And if you needed to get blood, you can have an unlimited supply as long as it's medically necessary, and you would have to pay for the first 3 pints. And for Part A, like I said, this is the free insurance, they call it. You don't have to pay any premium for that. Okay, so what does Part B entail? Part B is your medical expenses. It's your doctor's office. It's physical and speech therapy. It's diagnostic testing, durable medical equipment. You can have unlimited visits and supplies as long as it's proved medically necessary. And all you would be responsible for is 20% of the approved amount. Like I said, with your Part B, there is a deductible, and this is for 2020 numbers. For 2020, the deductible was $198. So if you go to the doctor to go see your family doctor, once you pay for that $198 deductible, you would only be responsible for 20% of the approved amount to your doctor. Clinical laboratory tests, these are things like blood tests, urinalysis. You can have unlimited if medically necessary, and that you pay nothing for. Home health care, as long as you meet the Medicare conditions with your Part B, you have unlimited, and you wouldn't have to pay anything for the services, the home care services. But if you needed medical equipment, here again, like a bed, a potty chair, anything like that, you would have to pay 20% of the approved amount. And outpatient hospital treatment, these are services, you know, like if you needed an x-ray, or if you needed heart catheterization, or you needed a treadmill, something like that. You can have unlimited as long as it's medically necessary, and you would only be responsible for 20% of that as long as you've paid your deductible. Here again, blood, you can have as much as you need. You have to pay for the first 3 pints plus 20% of the approved amount for any additional pints. And this Part B, this is the one that you pay for. And for 2020, the premium was $144.60. There are some freebies that you get when you are new to Medicare. They have what's called a Welcome to Medicare visit. It's a one-time visit. It's covered within the first 12 months of getting your Medicare Part B. That's a catcher. You have to be enrolled in Part B. If you just enroll in Part A, you don't get this. And what they do is they review your medical and social history. They do a calculation of your height, weight, and your body mass index. And they do a simple vision test. They do education and counseling. You know, we all think that once we turn 65, you know, that there isn't going to be any problems, or, you know, everything's going to be just like it was when we were 45. Well, we all know, for those of us that are reaching the 65 milestone, that's not quite true. So they will go ahead and educate and counsel us and see where we need, you know, we might need a little fine tuning in some places where we didn't need to before. And the doctor can go ahead and refer you for those additional screenings. And you get a yearly wellness visit. Sorry, guys. And what that includes is it's available every 12 months. It's just like a physical that you get once a year. They check your blood pressure, your height and weight. They create a personalized prevention plan. You know, if they are trying to prevent you from getting heart disease, you know, they're going to go ahead and personalize that plan to help you. They're not going to do a run-of-the-mill for everybody that turns 65, because we're all different. They're going to go ahead and do a written screening schedule. Well, you know, you need to have your cholesterol checked every 6 months. You need to have, you know, whatever, you need to have a mammogram, whatever it is, they'll go ahead and they'll create the screening schedule with you. And they give health advice that is tailored just directly for you. And if there's anything that you need a little bit more, like you need to we'll use the cardiac part of it, because that's my family. Excuse me. They can go ahead and do a counseling and send you for counseling sessions to help you prevent heart disease. That may include going to a dietitian, a nutritionalist, going to a rehab facility where you can do like cardiac rehab, those kinds of things to do prevention of your heart disease or whichever it is they're targeting. And here's a wellness and preventative service. Like I said, this is their Medicare schedule. Cardiovascular screenings, you can get one every 5 years. There's no cost for the tests, but you do have to pay 20% of the doctor's appointment. Mammograms, a woman 40 years of age and older get one once a year. There's no cost. Colonoscopy, you get one every 2 years. No, 120 months, year and a half, I think. Yeah, every 120 months. And then if you're at high risk, you get one every 2 years. There's no cost for the test, but you do have to pay the 20% for the doctor's visit and for the hospital copay. For women, the Pap test and pelvic exam every 2 years. If you're at high risk, you get one once a year. There's no cost. For men, for the prostate cancer screening, every man that's 50 years of age and older gets one once a year. Here again, no cost for the test. You just pay 20% for the doctor's visit. In the hospital copay, and we get one flu shot per season for free. And I'm not going to go through this because every doctor has a different schedule, but this is just the Medicare recommended adult vaccines, the flu, the tetanus, the pneumonia. They go through, every doctor is going to have something a little different. Each person is going to need something a little different. So I'm not going to spend a lot of time on that. The one thing I do want to say on this is, even though it's a Medicare recommended adult vaccine, that doesn't necessarily mean that Medicare will cover it. And so if your doctor wants you to have a shingles vaccine, you may want to check to make sure that your insurance will cover it first before you go in there and are surprised you have to pay for the whole thing. Here again, this just talks about the different vaccines and when you should get them. So we've all heard about Medigap policies, supplemental policies. They kind of go by both names. So what exactly are they? Medigap or supplemental policies are insurance policies that are sold by private companies. That's like your Blue Cross Blue Shield, your Aetna, your Mutual of Omaha, Priority Health. Those companies all offer a Medigap policy. And it's exactly what it says. What it is it fills the gaps between your original Medicare, that's your deductibles, your coinsurance, your copayments. When we were talking about Medicare will pay 80% of the approved amount and you're responsible for 20%, if you have a Medigap policy, they, in most instances, will cover that 20%. So it fills in that gap that is left between Medicare and the payment. All plans of same letter have the same coverage. And you'll see here in just I think it's in the next slide. With the Medigap, it's Plan A, Plan B, Plan D, Plan G, H. It doesn't matter if you buy a Plan D from Blue Cross Blue Shield or you buy a Plan D from Cigna. It doesn't matter. They're all going to have the same coverage. Where the difference is in the cost. And not all of the Medigap plans are offered to people under 65 with a disability. So you'll have to check if you're, if you're 50 and you are on disability now, you'll have to check and see if the plan or the company provides it. Okay, and here's what I was talking about. If it's a plan A, a plan D, it doesn't matter. These are the different plans that are available. Now, if you see over on the right, it says, and there's also, this is also included in your handouts. But if you notice on the right, it says Medicare first eligible before 2020 only. Plan C and F back before this year were the only two plans that would cover your Medicare Part B deductible. And so, you know, the other insurance companies, the CMS, all of them, they were like, you know, that's not really fair. You know, they're the only two that cover the Part B deductible. So, you know, of course, everybody's going to sign up for those, which is going to leave the other companies, you know, without anything. So to level the playing field and to make it more fair, they decided that, okay, we're not going to offer CNF anymore as of 2020, but the people that are already in it can stay in it. It's just we're not going to let anybody else in. So here it goes through and explains that gap that it covers. And you can follow the check marks across. If you, Medicare Part A coinsurance and hospital coverage up to an additional 365 days after the Medicare benefits are used up. All of them offer that. Your Part B coinsurance or copayment. Well, the only thing you're going, the only ones that are going to cover that at 100%, as you can see with the checks, are A, B, D, and G. K, L, and N, they'll cover them, but either at 50%, 75%, or there is a copay that's involved in it. You know, and you can go through and read and hear all of them. Well, not all of them, but for the Part A deductible, like I said, is the $1,408 this year. If you want that covered, so you don't have to worry about that, you can look at enrolling in a B, D, or G. And then, you know, it's like, well, you know, I have to cut down on my premiums. You know, I'm on a fixed income. So I want them to cover part of it, but I can't really afford a premium that for a plan that will cover all of it. So you can look at K, L, and M, and they cover them at their 50, 75, or 50%. And here you'll see that the Part B deductible, none of them offer that anymore. And for foreign travel, for emergency, like if you go to Canada once a year, you know, there are plans that will cover that. If you don't have that, Medicare typically will not cover outside of the United States. And like I said, this is in your handouts too, so you can look those over. So what exactly is a Part D, or your prescription plan? It is an optional Medicare prescription drug coverage. It's provided by private insurance companies. You must choose and join a plan. Medicare is not just going to automatically put you in a plan. So you need to choose and join that plan. And the plans have their own special formularies, which is the list of covered drugs. And you pay the drug plan a monthly premium. You pay that premium directly to the company that you decide to sign up for. And you are responsible for the deductibles and the co-payments. This year, the majority of the Part D plans have a $445 deductible that you would be responsible to pay first. You know, there are some in there that have lower deductibles, but if you are paying a lower deductible, you're paying a higher premium. So if you're looking for a plan with no deductible, just keep in mind, you're going to be looking at probably $50 to $60 a month that you're going to be paying specifically for your drug plan. And who can join Part D? In order to be eligible for Part D, you have to have at least Medicare Part A and or Part B. You must live in the plan service area. Each plan has their own service area, like we're Livingston County. You know, so if you put in, like say Howell's zip code, It's only going to bring up plans that are in our area. If you go to Oakland County, Wayne County, anything like that, and you sign up for a plan that is through Livingston County, your plan may not cover those counties and vice versa. You cannot live outside the United States. You cannot be incarcerated, and you must enroll in the Part D plan. Like I said before, in most cases, there is no automatic enrollment, and you must fill out the application. Your Medicare prescription drug coverage is available for all people with original Medicare, Parts A and B. It's provided through the Medicare Prescription Drug Plan or the Medicare Advantage plans that we'll talk about, or other Medicare plans. And they must include a range of drugs in each category. And I'll explain that to you more here in just a minute further on down the presentation. So when am I supposed to join a Part D plan? Well, if you're new to Medicare, you have that 7-month initial enrollment period. That's the 3 months before you turn 65, the month you turn 65, and 3 months after. The annual fall open enrollment, which I had talked about at the beginning, is from October 15th through December 7th, and your coverage will start January 1st. And then here is the special enrollment periods. If you have low income, you have involuntarily lost your credible coverage, if you've lost your job and your insurance is going to stop, or if you were on Medicaid and all of a sudden your income, because you're getting unemployment now, your income has gone above the requirements for Medicaid, and they're like, sorry, we can't offer that anymore. So there are ways you can sign up for it during that. Or, like I said, you moved outside of the planned service area. You decided you were going to move from Howell to Ypsilanti. Well, those are 2 different counties, and the plan that you were originally signed up in may not be offered in Washtenaw County, and you would need to contact the plan to join. You can either call the plan, or you can visit their website, or you can call Catholic Charities and talk to either Melody or myself, and we can go ahead and talk you through that. Okay, so Part C, Medicare Advantage. And if you've turned on your television, if you've watched television at all of you have seen Joe Namath sitting there telling you about all of these great plans that you can get dental, and you can get vision, and you can get hearing aids, and you can get all of this. That is the Medicare Advantage plan. And for some people, it's absolutely perfect. For other people, it's not so great. All of the health plans that are available have been approved by Medicare. They're all run by private companies. I can tell you probably 95%, if not 100% of the companies like Blue Cross Blue Shield, Priority, Cigna, and any of the big Aetna, they are offering Advantage plans now. And Medicare pays amount for each member's care. It's another way to get Medicare coverage. It's part of the Medicare program, but you have to use network doctors or hospitals. Like I said, they're HMOs or PPOs. So if the doctor that you currently see is not in network and you sign up for an Advantage plan, you're going to have to pay an out-of-network cost, which is usually anywhere from 50 to 80% of the office visit or the service. So how does an Advantage plan work? Well, it still has all the rights of Medicare and all the protections of Medicare. You still get your Part A and Part B services, and a good chunk of them do include prescription drug coverage. And like Joe tells us, they do offer extra benefits like vision or dental. And the benefits and the cost sharing between the different companies may be different. Okay. So when do you enroll in a Medicaid, Medicare Advantage plan? Sorry. You've got the 7-month initial enrollment period. You can join during the annual fall enrollment, which, like I said, is October 15th through December 7th. And then your coverage would begin January 1st. But Medicaid, the Advantage plans have different open enrollment periods as well, which is January through March. You can, if you have a company like Priority Health that you're just all hot that you want to join, you can call their number, visit their website, or you can go to medicare.gov, or excuse me, like I said, you can contact Melody or myself and we can enroll you in that. Sorry. But the one thing that I do want to kind of talk to you guys about too, when you're looking at an Advantage plan, you know, yes, it offers the vision. Yes, it offers the dental, or some of them do. You know, they offer the hearing aids, but you've got to make sure and look at what the plan that you're thinking about covers. The majority of them will cover the basic, we'll just use dental for right now. They'll cover the basic dental, which is your office exam, cleaning, and x-rays. But if you need to have a filling, if you need to have a tooth pulled, you need to have a root canal, anything like that, the majority of them don't offer that type of coverage. So what you need to do is you need to buy a rider for that, which is like preventative dental coverage or preventative optical coverage. And that's always an extra amount that they tack onto your premium. So when you're looking at these plans, just make sure you know what you're looking at and know what you're wanting. And this is why I get so angry. My husband gets so upset with me because I sit there and yell at Joe Namath on the television because he doesn't tell you that part. He makes it sound as though it's just so great and so wonderful. And for some people it really is, but he doesn't tell you. It's like, yeah, you're going to sign up for this, get dental. You're going to need dentures. And the plan that you chose doesn't offer it unless you pay an extra $45 a month. And then they have a cap at what they're going to pay. And so they may only pay like $800 or something like that. Well, you're going to be responsible for that extra part. So when you sign up for an Advantage plan or you're looking at an Advantage plan, just know what it is you're looking for and what questions to ask as well. And all of these prices sound really good. You know, it's like, oh my gosh, it's so overwhelming. You know, the Medicare Part B is $144.60. If you're going to sign up for a Medigap policy, that could be anywhere from $100 to $300. Then you've got a prescription plan. You know, all of this, and you're sitting there thinking, it's like, oh my gosh, my Social Security is only $1,500 a month. How am I going to be able to pay for this? There is extra help for people that have limited income and limited resources. You can sign up for extra help that is for your prescription coverage. That can help with your Part D premium. It can help with your copay for your drugs. You can sign up for Medicaid. And if you sign up for Medicaid, there's through the Medicare Savings Program and the extra help, Medicaid kind of oversees that. But there's the Medicare Savings Programs that help pay a portion or all of your Part B premium. Some of the insurance companies, if you sign up for a Medigap policy, like Blue Cross Blue Shield, Priority Health, I think is one, AARP is one, they offer what's called a Medigap subsidy. And depending on your age, you can get part of your premium paid for through the subsidy, or they take off a part of that, of what the premium is. And it goes according to your age as to what the amount is. And there's the pharmaceutical assistance programs, like through EJ Lilly, through Novartis, any of them offer assistance programs you can talk to your doctor about. And there's also the prescription savings cards, like the Good RX, the Kroger Savings Plan. One thing, just real quick, I want to talk about, like, if you have the Kroger Savings Program, I get this question quite a bit. They're like, oh, well, I have the Kroger Savings Program. It's like, okay, now is that my insurance coverage? Is that my Part D coverage? No, that does not count as insurance coverage because it's not. It's just a savings program that can save you money. So Medicare does not recognize that as having adequate insurance coverage. So if that's all you had when you turned 65 and now you're 70 and you've decided you're going to sign up for a Part D plan, you're going to get that penalty even though you had that. So just to make sure they don't count that as reputable coverage. So Medicare fraud, we kind of talked about it a little bit. Medicare fraud is the most common scheme that affects seniors because all of us are getting the wonderful phone calls. And what it is Medicare, Medicaid is billed for services you never received and equipment you never received or you returned it. You get this, all of a sudden you get this knee brace, back brace in the mail and you're like, I didn't order this, what the heck? So you send it back. And normal things for normal people, that would be credited to your account, but scammers will not. So it still shows through Medicare that you received that. Someone uses your Medicare Medicaid card. People are really crafty when it comes to using the computer now, and they can hack into things. We've all heard about that on the news. So people can hack in and get your Medicare Medicaid numbers. So just make sure that the sites you're using are safe and protected sites. And a company will use false information to mislead you into joining a Medicare plan. Right now, during open enrollment, this is probably the biggest thing. When I was talking about the insurance brokers that make the money and get a stipend from the company, they will try to get you to join an insurance company only because they get a higher kickback from that company. They're not going to look at it and say, oh, well, no, your medication that you're currently taking for your cancer is not going to be covered under that plan. You're going to have to pay for it out of pocket. Or with poor Joe Namath, I pick on him so much, or the Joe Namath plans from TV, you fall for and you get into the Advantage plans, and nobody tells you that you're going to have copays for every single thing you do. And here again, your cancer drugs are not covered, or your doctor, they never shared with you that it's an HMO or a PPO and your oncologist is out of network. So you're going to have to pay completely for that. Right now, that's like the biggest thing, just so people can get you to sign up for the company they benefit from. They have sent out new Medicare cards back a few years ago, back in the day. Your social security number was your Medicare number. That is not the case anymore. Anybody that is on and has been on Medicare, they should have received the new cards. Each Medicare card and each person has their own unique 11-digit alphanumeric number. Your benefits are going to stay the same. Nothing's going to change because they changed your numbers. So now if your card is still the one with the social security number and you haven't received the new one, you need to contact the Medicare office or Social Security to get your new cards. Okay, and we are here for you. If you need to speak to one of us, you have a specific situation that is unique to you, you have a question that you need to talk to someone about, give us a call. Every volunteer, it doesn't matter where you are at, just go to the MAP website, or you can call MAP. I'll have the numbers here in just a minute. and you can give us a call. Our services, we're not going to tell anybody. It's all confidential and it's unbiased. We're not going to, try to sway you into a certain one because, our aunt works there or whatever. It's all unbiased information. We can counsel over the phone and we can counsel in person. A lot of people with the pandemic right now, they're not comfortable going into people's home. We at Catholic Charities can't go into people's homes right now, but our volunteers, they're not comfortable going into people's home, and people aren't comfortable having us come into their home. So we can do the majority of our counseling over the phone right now. And don't think that any question you have is too silly. Medicare and Medicaid is flippin' confusing, even for us. So don't think that any question you have is silly, because that's what we are here for. And hopefully the answer we give you isn't going to confuse you or complicate things more. We try not to, but sometimes the nature of the beast is that the answers are complicated and they are confusing. And so we try to, clear it up for you. So don't ever be afraid to ask a question. The only bad question is one not asked. And here is more information. If you're computer and techno savvy, you can go to the Medicare.gov website. You can get the Medicare and You handbook. If you guys don't have one, just let me know or let Melody know. And we can get you one. And in Heartland, I know you guys have the most amazing senior center in Heartland. It is like one of the best. Contact Kim Konarski or contact the senior center, because I bet you $1 to donuts, Chris has, I think her name's Chris. They have their own community liaison there. I'm pretty sure she probably has the book, but either call the Heartland Senior Center or call me or Melody, and we can get you that book if you haven't already gotten one. You can always call 1-800-Medicare, and then you can also call the MAP office at 1-800-803-7174. And I'll give you the number for Livingston Catholic Charities, because you can call us as well. The number is 517-545-5944, and you can ask for either Beth or Melody, and we can help you through that. And I think, yeah, without any further ado, it's done. So
Great
there
job.
you go.
Good job, Beth. Thank you so much. I know there was a couple questions in the Q&A, and
Oh, okay.
looks like, well, it's okay. You answered them. So,
Oh, did I?
yeah. So if anyone doesn't have any other questions, I mean, I think you were very thorough, and there's some good resources. And I did put the link in the chat. So that will be available while we're doing the webinar. So if you would like to click on that now, all the attendees that are listening in, if you open the chat and click on that link with all of those great flyers that Beth provided and save them to your own drive or download them now is a good time. So I don't think anyone has any questions. We're just about an hour. So I really appreciate all of your time today, especially you, Beth.
Thank you for allowing
Very
me to come and
informative.
talk. And
Of course.
hopefully hopefully I answered questions, or like I said, if you have any more questions, please feel free to give us a call. That's what we're here for. And I would be more than happy, or Melody, either one of us would be more than happy to help you. So thank you for allowing me to come in and talk. I appreciate it.
Of course. Thank you. All right, everyone, enjoy the rest of your week. And like Beth said, you can either reach out to us here at the Chamber, or you can reach out to Beth at Catholic Charities. And with that, I think we're good. So.
All right.
All right. Bye, everyone. Thank you so much.
Bye, guys. Thank you.